Good afternoon, everyone. My name is Sarah Philbin, and I'm a PhD student in Health Services and Outcomes Research at Northwestern. This evening, I'll be speaking with you about people and places and their impact on treatment choices in healthcare. I'd like to start off with a story about a patient named John. John was in a severe automobile accident, and as a result, he developed chronic neck and back pain. John was prescribed opioids, or what we might colloquially call pain medication, to address the symptoms of his chronic pain. However, in the aftermath of John's accident, as he continued to take opioids, he eventually developed an increased tolerance for them, cravings, and withdrawal symptoms. And as a result, John was ultimately diagnosed with what we call opioid use disorder, or OUD. Now you might be thinking to yourself that what I just described sounds a lot like addiction, and that is true. However, some patients find the term addiction to be stigmatizing. And for that reason, I have decided to use the formal diagnosis of OUD for the purposes of this presentation. And OUD is a very pressing public health challenge in the United States. Its rates of diagnosis are increasing, and it can ultimately lead to death. And even if things don't reach that point, patients with this diagnosis can experience lost productivity at work, challenges in their relationship with family and friends, and at a societal level, this diagnosis can lead to increased costs for both our criminal justice and healthcare systems. So back to John's story. John eventually ended up presenting to the emergency department overnight, experiencing withdrawal symptoms. And when he arrived, he did not receive what is called medication-assisted treatment, or MAT. And MAT is considered an effective treatment for OUD because it helps to address both cravings and withdrawal symptoms. And my research seeks to understand why this is. Why did John, along with many patients like him who present to the emergency department, not receive this effective treatment for their condition? And I hope to use this example to demonstrate to you how the selection of treatment choices in healthcare can be influenced by factors at both the physician and the clinic level. So first, how do we do this type of research? Well, first, we start with what we know. We know that medication-assisted treatment is an effective treatment for OUD. As I mentioned, it helps to address cravings and withdrawal symptoms. However, we know that what we know does not align with what we do. In the context of the emergency department, we have data that there is a low use of MAT in this setting. And as a result, there is a gap between what we know and what we do. And my work leverages what's called implementation science to help us understand what factors are at play in this gap between what we know and what we do. And some things that we're interested in learning about within this gap include the acceptability of different treatments, so the acceptability of a treatment for physicians, for example, as well as the feasibility of using a certain treatment in a particular setting. So back to the example of MAT and for OUD in the emergency department. This idea of physician-level factors. So many emergency department physicians report that they have limited knowledge about MAT. They might have encountered the treatment in their training. However, because it's not something that they use every day, they lack a certain degree of comfort with it. Secondly, you might recall from earlier in the presentation that I mentioned that OUD can be a stigmatizing diagnosis. And this stigmatizing perspective is not limited to the general public. Physicians can also hold stigmatizing views about patients with OUD. And some emergency department physicians have reported that these patients are difficult or challenging to manage. And the initiation of MAT can require a nuanced conversation, a delicate conversation between a patient and a provider. And because of the perspective that some of these patients are challenging, emergency department physicians might not want to engage in that type of conversation. And finally, some emergency department physicians report that the prescription of MAT is simply outside of the scope of their role. MAT requires follow-up between a patient and a physician. It's not a one-time treatment option. And for that reason, some emergency department physicians report that MAT is better prescribed by physicians in other practice settings, such as substance use treatment centers. So the clinic level factors. factors. If any of you have ever been to an emergency department, you might know that it can be a very crowded place. And this overcrowding can put constraints on both time resources and staff resources. And as I mentioned, the conversation around that can be somewhat delicate, and that might not necessarily mesh well in an overcrowded clinical environment. Secondly, time of day. As I mentioned, John, for example, presented overnight with his withdrawal symptoms. And for that reason, while the emergency department is open 24/7 typically, other healthcare settings are not. And it can be challenging to make referrals to other settings for patients if they present to the emergency department overnight. And again, this idea of connection with follow-up care, and this point comes from research with emergency department leadership. Some of them report that their departments simply don't have existing relationships with some of the community-based health settings where they might refer patients, such as substance use or behavioral health treatment centers. And for that reason, MAC can be a challenging prescription to use in the emergency department. So where do we go from here? In terms of next steps for research, there's some evidence that different educational mechanisms for physicians and different process improvements for clinical workflows in the emergency department have the potential to improve the uptake of MAD. So one opportunity for further research is to explore those options. However, there's a broader takeaway here for a general audience. Any of us can find ourselves as patients at any point in our lives. And for that reason, I would encourage you at your next doctor's appointment to simply ask questions about what treatments are being prescribed to you. Thank you.